overactive parathyroid glands. This is called hyperparathyroidism. You have 4 parathyroid glands, and they're located behind or sometimes inside of your thyroid gland. The parathyroid's job is to maintain calcium levels in the blood at any cost, and this is necessary so your muscles can work and your heart can beat. They can borrow calcium from your main reservoir, which is your skeleton, to accomplish this. The glands are extraordinarily sensitive to calcium levels and will respond to low calcium very quickly, as well as shut off when calcium is high, on the order of seconds to minutes. We measure parathyroid activity by lab tests for parathyroid hormone, or PTH. What happens if it's overactive? When calcium rises significantly, patients can feel poorly, sometimes even psychotic in extreme situations. They tend to have abdominal pain, nausea, constipation, and are prone to kidney stones. Because the parathyroids are leaching calcium from the bones, those bones become thinner and prone to fractures, which is called osteopenia or osteoporosis. There are 3 types of hyperparathyroidism. Primary hyperparathyroidism is excess or even normal PTH despite having a high calcium. Remember, PTH should shut off immediately when there's high calcium. So a normal PTH is inappropriate when there's high calcium. This is a situation where the gland fails to shut off and most frequently is caused by an oversized parathyroid gland called an adenoma. This is treated by surgical removal unless the patient is not a safe candidate for surgery. Secondary hyperparathyroidism is excess PTH when the calcium is low or normal. That PTH is trying to compensate for there being low calcium and trying to make it normal. Most commonly, this occurs in patients who have kidney disease, but it can also be caused by low vitamin D or high phosphorus levels. This is treated by finding the underlying cause of excess PTH and resolving that problem. Otherwise, there is a medication called cinacalcet which tricks the body into thinking the calcium is already high, and this will reduce parathyroid hormone. Tertiary hyperparathyroidism is extreme elevation of PTH with high calcium. This occurs when secondary hyperparathyroidism has progressed beyond medical treatment. At this point, usually all 4 glands are enlarged and function independently, meaning they don't pay attention to any of the cues to stop making PTH. We treat this by surgical removal of 3.5 of those parathyroid glands. You can function quite well with just a portion of 1 gland. What if my calcium is high and my PTH is low? Why is my calcium high? When the PTH becomes low or undetectable, when there is high calcium, this is a normal response. It's not the PTH's fault. So now we have to look for other reasons, like cancers or certain vitamin toxicities, to explain why the calcium is high. When you have questions about this topic, the Mayo Clinic has a wonderful section about hyperparathyroidism on its website, as does the National Institutes of Health.